Okay, Dr. Kate Purvis, thank you for gracing us with your presence all the way from Portugal, which I just discovered. And before we hit record, we were talking about all the amazing things about Portugal and your travels. And so, just so that the listeners get a little sense of who you are, just give us a little bit of a background of how, like basically your journey to becoming a naturopathic doctor, a board certified lactation consultant, a holistic sleep coach, and now you're in Portugal doing your thing.
Yeah, thank you so much for having me. I'm so happy we have the time to chat today.
Me too.
So as Dr. Cindy mentioned, I'm a naturopathic doctor. I grew up around physicians and I always wanted to be a doctor. My mom's a doctor, my sister's a doctor, but something about conventional medicine just didn't sit right. I saw my mom kind of always struggle with not being able to serve her patients. She's a pediatrician, not being able to serve them in a way she was totally happy with, not having as deep of relationships with her patients that she wanted to, and it didn't quite sit right. And I kind of stumbled across naturopathic medicine, and I was like, oh my gosh, this is it. This is for me. This makes so much sense, like treating the whole person and not just treating, specific parts of people. And so I found out more and went to naturopathic medical school in Arizona. I graduated, goodness, 9 years ago now, which feels like forever, forever ago. And right after naturopathic medical school, I went into a general medicine residency there, and I got pregnant with my first, and had him the day after my residency was over. And
Good timing.
I had this, right? I know. It was like we planned out perfectly. I mean,
Yeah.
totally just coincidental, but it worked out beautifully. I prepared so much for birth, and it was I put my heart and soul into preparing for this amazing, empowering, beautiful birth, and it was so life-changing and incredible. And then I got home with this baby, and now I'm like, now what?
Mm-hmm.
I had zero preparation. And, I thought just as a naturopath that I would know, right? I would know what to do to recover, would know how to breastfeed, I would know how to do all of these things. And I didn't, which, I know, and I know that your listeners know that it just can really catch you off guard postpartum. And so I was just so caught off guard. I had no idea what to do. I had this baby that didn't sleep. He was actually a very normal sleeper, but at the time I had no idea that that was normal. He wanted to nurse all the time. Again, I didn't know that that was totally normal. And I was exhausted and I was depleted and I felt so isolated and so alone. And I just was like, this has to be different, right? This experience has to be different for women. And so I started to look at the treating the dyad together. So what happens if you treat mom along with treating baby? And that kind of got me into the lactation world and the sleep world. And here I am 9 years later, working with moms and babies together.
Mm-hmm. It makes a lot of sense. And I feel you because I had a similar experience. And I think that we just kind of get so like blindsided by what to expect if we don't have the support around us. And I was lucky to have the support of midwives for the first 6 weeks, and I found that incredibly supportive. But when I think of women who don't have that, it's like you're really just like left and like trying to figure things out on your own with like Dr. Google and like whoever's around you. And it's just this idea of the like mothering the mother, which you like to talk about. I like it makes so much sense because you're in such a different state that you've never been in. You're not sure what to expect, and you need the care and nourishment from the people around you. It's so crucial.
Yeah. And I know you've talked about this with guests in the past, but there's so much focus on mother until delivery, right? You go from
Mhm.
having so many different appointments, so much lab work done, so much focus, and then baby's here and you're kind of just left flying by blind. I mean, most women have one follow-up visit at 6 weeks where you're asked about birth control, and that's it. That's kind of all
Yeah.
you get. And we're just left with increases in postpartum depression, postpartum mood disorders, increases in autoimmune disease, increases in even things like heart disease, postpartum heart disease are increasing right now. And we're not given that support, and we're not giving moms that support to be able to manage all of these things. So until kind of uh, the shit hits the fan, excuse my language, until something really kind of traumatic happens, moms aren't taken care of, and there's no focus on mom, which is really, really unfortunate, not only for mom and her future health, but for baby as well, because the health of mom affects baby, affects everything with baby.
Absolutely. Like when mom is well, the baby is well, the whole family benefits when the mother is nourished and taken care of. And when that first 40-day window is really like given the attention and the reverence that it deserves,
Yeah.
for a mom to heal. And me and you both experienced nice, empowering,
Mhm.
transformative births. And
Mhm.
still we felt this sense of like what do I do now? Like, oh my gosh, you know? And so I think about the women who had like a quote unquote traumatic birth experience
Yeah.
and had to do a lot of physical, mental, emotional, and spiritual healing if they were even given the space to do that. And
Right.
then thrown into everything that goes along with the postpartum period. Like, of course, the rates of postpartum depression and anxiety are skyrocketing. And you're mentioning heart disease because women process things so differently, and yeah, it's just that one appointment 6 weeks postpartum is not enough. And some women
No.
don't even know they have the resources of a lactation consultant or a midwife or a sleep coach or any of these things that can be like a lifeline, really.
Exactly. And it's a really good point about women who have traumatic births, because most women don't even realize that that needs to be processed until it pops
Mhm.
up down the line, future postpartum experiences or future deliveries, or even, later, because we aren't given that time and that space to really work through if there was a traumatic aspect of the birth. And,
Mhm.
a birth can go beautifully and there can still be some trauma attached to it if it was
Mhm.
something that wasn't expected, or it just went a little bit differently than what mom uh, was expecting. There can be some even just emotional, I don't want to say just, there can be some emotional trauma as well that kind of gets shoved down if it's not able to be talked about or processed.
Yeah, I agree. And even when you have this birth experience that was very transformative and empowering and all of those things, it's still helpful for your nervous system to process that experience because it is such an intense experience and
Mhm.
so transformative. Like our nervous system still has to adjust to that. And I mentioned this on the podcast once before, but I couldn't, like, I delivered in my bathtub and I, I had a hard time looking at it for the
Wow.
first few weeks because it was
Yeah.
such an intense experience, like on all levels. Like physically, I've never felt those sensations. Emotionally, I've never felt those sensations, you know? So
Yeah.
I still, even though it was the experience I had desired, I still had to process it. So for anyone listening, um, and Kate, you know Dr. Alexa, and you know Carrie, we're hosting on July 10th. If you're listening to this before that, a birth story processing event just to support women, like no matter what your experience was, to kind of help your nervous system process that. So you're kind of like completing a cycle and given the space to do that,
Oh,
which we don't
oh, that's
really give
beautiful.
ourselves. Yeah,
Yeah,
yeah.
that's so beautiful. I'm so happy you guys are doing that because it is so important, even if you have the birth of your dreams, the delivery of your dreams. That's
Yeah.
beautiful.
Yeah. Because it's still an intense experience. And then when we talk about what goes on, like like, I assume most people have a partner. Not everyone does, but you're at home, and like this affects the relationship. It affects the emotional climate at home. And so when mom is supported, then the relationship also benefits. And of course the baby, the other children that may or may not be there also benefit from that. Um, which isn't talked about enough. Like
Mm-mm.
the weight that some of these things have on a partnership. It really
No.
isn't talked about enough.
Yeah. No,
Yeah.
absolutely not. I mean, I know my husband and I really struggled in the early years of
Mm,
after our first was born, and repeated again after the second as well. Like it's really there were expectations that I had of him that he had zero clue, and there were expectations that he had of me that I also didn't know. And then you add sleep deprivation and all the depletion that comes with pregnancy and postpartum on top of that, and it really everything changes. And that's another thing I don't think we prepare for. We don't prepare our relationships for postpartum either.
yeah, yeah, absolutely. And it needs to be something that's spoken about, like almost like, excuse me, those marriage courses where you like ask each other a bunch of questions. Like there needs to be something like that before you have kids.
Yeah.
Um, And so it's not a major part of the program I created, but two things you mentioned was like you came home with baby and you were like, now what? I actually have like a now what section.
That's brilliant.
Yeah. And I have questions to ask or talk to about with your partner before baby arrives, because these are things like we're not really prepared for in any way. And so yeah, it's not just about the actual birth. It's not about just the healing and the lab work and all of these things. Like there's so many factors and variables and nuances that can go into what it actually means to support this dyad that you're talking about. Um, and really, like I'm in this world and I haven't really heard that term, the dyad, but it makes so much
Yeah.
sense. Yeah.
Yeah.
Like
I
mom
think,
and baby together.
yeah, I think we talk about it more in lactation. And so it's kind of spilled over into the rest of my work as well. But I mean, mom and baby are so connected in so many different ways after delivery. And so taking just the mom or taking just baby is really doing everybody a disservice, right? When
Mm,
you can hold both together and help that relationship really grow in not just like a bonding sense, but also, our nervous systems are so connected. If you're breastfeeding, that's another point of connection. Your microbiomes are even connected from the early days. And so when that can be just nurtured together, just the health and wellness of everybody benefits.
mhm. Yeah. What would be some things specifically for lactation that you would want anyone who's preparing for birth to know to kind of to support that process so that it has the least amount of obstacles as possible? Like very much like around the birth process itself, within that like that golden hour, the first week or
Yeah.
so postpartum.
Yeah, I think so. My biggest thing when women are pregnant and I ask about lactation is to because people have this kind of misconception that it'll just come naturally, or I'll know what to do when baby's here, and most of us don't. I certainly didn't. I didn't know what to do. I was kind of like, oh, okay, now what? And I had taken a
Yeah.
class, and I still didn't know what to do. Um, so understanding that it might not come naturally, and that's okay, right? It's a learning process for everybody involved. It's a learning process for baby. They've never done it. It's a learning process for you. And of course, getting that immediate skin to skin as soon as you can is going to help. I love watching those videos of babies doing the breast crawl. I don't know if you've seen those after birth, or I don't know if you've had that experience, but
Yeah.
so there'll be babies laying on the chest and they'll crawl essentially their way to the breast to latch themselves. Which is absolutely amazing. So just providing baby with that opportunity to do that is going to be super helpful around birth. So as much skin to skin as you can possibly do after birth is my, number one tip. And then just, we have so many, like our what am I trying to say here? We have this kind of obsession with tracking everything these days, right? With apps and how many times did baby eat and how long did they eat each side? And I think one of my biggest tips around that is to let yourself get into a rhythm as much as you can, where you're recognizing your baby's individual feeding cues, and not relying on oh, well, they ate 2 hours ago, they don't need to eat for another hour, right? Because most likely they're going to be at the breast often in those early days, and we want that. They're supporting milk coming in, they're supporting the establishment of that relationship. And so kind of leaving the trackers aside, leaving all of the, oh, well, they shouldn't need to eat, all of those shoulds aside, and just focusing on nourishing that relationship and kind of that dance that goes on between mom and baby in the early hours and the early days is going to help set you up for for meeting whatever breastfeeding goals you have. And then of course getting help. Pain's not normal. Don't let anyone try to tell you otherwise, that you have to push through that pain. It's not normal. And it should be a good experience for both mom and for baby. So reaching out for help if you need that support as soon as you can.
Mm-hmm. Yeah, for the breast crawl, I did that with both of my daughters.
Yeah.
For my first daughter, it took about 2 hours, but I was, or maybe less. It took a while, but I was patient and I wasn't like trying to force or rush this first feed. And
Mhm.
I think that really helped. I think it really supported the prolactin and the oxytocin and the letdown and all of these things. And so, if anyone wants to try that, like I think just be patient. Give baby lots of time. As long as baby is and mom are skin to skin, it can take as little as, I think with my second, she did it right away. Like I was still in the bathtub.
Yeah.
Yeah, but with my first, it took a while. So every baby is different and every birth is different. And just be patient with that. If you do want to try it, I would I would go like it's an amazing thing to see a newborn, like just minutes old, move that way. And it's
Mhm.
so instinctual and like the reflexes that they have to just find exactly where they need to go is so incredible. And then they're in that sanctuary. And I really feel like that's kind of like the first key to creating this breastfeeding relationship and the groove that you're talking about and that dance. I always talk about a dance in the birth process, like mom and baby kind of signaling to each other and moving together to allow baby to move down the birth canal. But I love that you're talking about this dance still, like after baby has come out. It really is like a partnership, like a dance. I love those words that you use.
And I think that continues for years, right? It doesn't just end immediately. There's that dance, that rhythm that happens in the first couple of years for a mom and baby together. I love that you had that experience of the breast crawl. I did not have that experience. My first my midwives kind of put him right on the breast, which I wasn't really expecting. I thought they would have done more skin to skin right away, like just, let him sit there. And then my second was a C-section in Portugal, and they took him away and dressed him. So that was also a totally different experience than what I was
Yeah,
hoping for. I love that you had that.
yeah. And you had that in a different country. That must have been very interesting to navigate.
Yeah, it was fascinating. I mean, luckily, I know we're kind of getting off topic here, but luckily luckily I knew I had to have a C-section before we moved here. We moved here when I was 34 weeks pregnant, and I knew already that I had to have a C-section. I had a complete centroprevia,
Oh
and some
wow.
issues with that. Yeah. So I knew that was coming, which kind of made it almost easier that I didn't have to, I think, fight so much for a different kind of birth in a country where I didn't speak the language. So
absolutely. Yeah.
yeah.
Yeah. It is very helpful when you know what to expect going in, um, and didn't labor for hours and hours and hours before finding out that it had to end in a surgery, right? So I think when you know what to expect and you can kind of mentally prepare for it, it makes it a lot easier to process whatever happened afterwards.
Yeah,
And
exactly.
as a naturopath, did you do anything with the C-section to kind of support that dyad that we're talking about, or your healing and all of those things? We haven't really discussed that on the podcast yet.
Yeah, so I mainly use homeopathy surrounding birth, which I know you love homeopathy with birth as well. So
Yeah.
I did a lot. I guess I did some acupuncture leading up to the birth as well, mainly to try to get my placenta to move, which it never did. But I did a lot postpartum healing from the C-section with homeopathy. So like I had a lot of tailbone pain, so I used a lot of hypericum. I had a lot of C-section pain, so I used staph and arnica. And then I really wanted to do vaginal seeding, which I think you just had somebody on talking
Yeah.
about that, and I just couldn't get my act together to do it, and I didn't know how to kind of facilitate that in a foreign country. I think they would have thought I was totally crazy, which they already did. I was refusing pain meds, and they were, "What are you doing?" So
Yeah. Yeah. I know you pick your battles, and it's also like sometimes we have the knowledge of what our options are, and it's really like what is your capacity at that moment, what's your support in that time. Like there's a million and one things that we can do, but it's and I felt the same way, like with motherhood, like there's all these things I could do, but what's your energy level, what's your capacity, what are like how much are you sleeping, like all of these things. So it's really just picking those things that you feel are a priority and going with it. Yeah.
exactly. And for me, my priority was getting lactation established as soon as possible because I knew that was going to be a struggle, that they were not going to put him on me immediately. Like we'd already had that conversation.
Mm-hmm.
And I know in the US and I believe Canada as well, that is pretty supported these days, where post C-section, they'll do immediate skin to skin, but they, for whatever reason, it's not hugely done here. So my priority was truly getting him on the breast as soon as I could after delivery and after getting
Yeah.
that part taken care of. So that was my battle that I chose.
Yeah. Yeah. And that's one of the ones that it's going to set the stage for months and months to years, right? So
Exactly.
it's a good battle that you chose. When
Yeah.
you say pain is not normal with breastfeeding at all, like even like your first time.
So you can have those twinges that I think many women experience, like right as you're latching in the early days, is normal. As you're dealing with engorgement and kind of those changes that happen, there can absolutely be some pain, but the pain should never last beyond like the first minute of latching. It shouldn't last beyond those early days of that pain on initial latch. It shouldn't go beyond that. And I see so many moms just kind of grit their teeth and try to get through the breastfeeding sessions, and they're in so much pain. And it doesn't have to be like that. They can be comfortable with how they're feeding and continue to breastfeed. And how we feel as moms matters so much too, right? The fact that we are comfortable with how we're breastfeeding and we're not in pain. It matters. It matters for the longevity of the breastfeeding relationship, and it matters for our overall well-being too, right? Our overall stress levels, our nervous system. If you're sitting there in pain, kind of gritting your teeth, like that's all going to be affected.
Yeah. Yeah. Yeah, totally. I did have to deal with a little bit of, I should say, a lot of discomfort and like, um, I wouldn't say it was an infection, but
Mm-hmm.
I did have to use that, the, sorry, his name is just leaving my head right now. The big lactation guy.
Newman, Jack
Yes,
Newman.
yes.
Yeah.
Yeah, Jack Newman. I did have to use his formula, and
Yeah.
I did feel like that really helped. So anyone listening, like if you're feeling like, the actual breast tissue, the nipple tissue is just not adjusting well, there are options that you can use. Do you typically go to that formula, or do you use homeopathy or anything else?
Yeah, so I have definitely used it in the past, and I used it personally with my first baby as well.
Mm,
He had a lip and a tongue tie that I probably should have had corrected that I didn't, and it's kind of what got me into the lactation world, and that caused some pain, and so I used the formula for that. Um, there are so many different causes of pain while breastfeeding, whether it is, tethered oral tissues or inflammation, clogged ducts, mastitis, even, mammary constriction syndrome, mammary constriction syndrome, which is when mom gets really, really kind of tight because she's all curled over, and that can lead to ton of pain or vasospasms or, things like that. So it really depends on what that root cause is. I mean, I love homeopathy, especially in early postpartum where there's not a ton you can take. There are lots of herbs and things like that you can take, but I find homeopathy to be incredibly helpful as we're trying to figure out what's going on. And then of course, having somebody take a look at the latch and what's happening there, as well as just the breastfeeding position. Is mom relaxed and open, or is she all curled up and hunched over, which is going to cause so much more pain. I do use some herbs, especially topically, like calendula is so beautiful, especially in those early days, or if there's any kind of cracked nipples, that kind of situation going on. So yeah, I use a bunch of different things. It really depends on what the cause is, though, of that pain. So getting to that root cause is so much else in our medicine, right? It's so important there as well.
yeah. You brought up a good point about there's not a ton that you can use. Like there's
Mhm.
so many contraindications when it comes to pregnancy and birth and lactation and the postpartum period. And they're like, it would be great to just, open up one of our herbal or botanical medicine manuals and just be like, oh, we could use this. But yeah, I find homeopathy to be really great for that as well. Like, you're not going to be contraindicating with any other medication. It's not going to negatively impact the baby. Um, so there's also like a convenience factor to it, and it's super gentle and yeah. So along with herbs and other things topically, I find homeopathy to be so great in this phase of life for moms and babies in that dyad.
Yeah, absolutely. It's by far my favorite and most used modality, definitely with moms.
Yeah. I wanted to ask you, like, is there a controversy about tongue tie?
Yeah, there's lots of
Yeah, because yeah, it just I don't know, this whole phase of someone's life, there's a lot of controversy around it when really I don't think there should be a lot of controversy.
No, there seems to be so much controversy around tongue ties and tethered oral tissues about whether they need to be revised, whether you can wait, do they cause issues later on if you do wait. Um, is baby, often what we see when there's tethered oral tissues, that baby compensates at the breast, and that can lead to pain for mom. And then can also lead to, anecdotally, people say, to difficulties down the line, difficulties with speech, difficulties with eating, with swallowing. And there's no real consensus about what should be done. It's really, really a case by case situation with what if the parents have the bandwidth to go through the whole process, because it's a process. It's not as easy as just getting it, lasered or snipped and going on your way. It's baby has to essentially unlearn these movements that they've made in order to compensate and to feed. And that can take a long time. It can take a lot of oral exercises, which aren't, a lot of parents don't love doing those because baby doesn't really like those very much. It can take a lot of body work. It just takes a lot of involvement, and some parents don't have the bandwidth to necessarily deal with that. Whereas others are like, yep, let's do it. I'll do whatever I have to do. And then there's no real consensus about whether it makes as much of a difference as people say it does. So unfortunately, there's no easy answer surrounding tongue ties, but yep, it's super controversial.
So interesting. Yeah.
Mhm.
um, I did want to ask just about the breast milk itself,
Mhm.
and from your experience and from your knowledge, how it shifts over time as baby is developing, and as things shift in their environment. I'd like you just to speak to that, because it's really fascinating for me. Like, it starts off with colostrum, which is
Yeah.
like liquid gold, and it's actually gold in color. And then
Mhm.
it just keeps morphing and shifting, and, like, it's so specific to the stage and the
Yeah.
baby, and all these things. It's so fascinating. Like, the more I
It's
learn, the more I'm like, "Oh my gosh, like, the human
yeah.
body is so wise."
It's so fascinating. And yeah, as you mentioned, it starts with colostrum and then it shifts into mature milk after a few days. And that shift is gradual. It's not like all of a sudden, oop, milk's here, mature milk's here. What I find so incredibly fascinating about it is how individual breast milk is. So how it changes if baby is sick, that baby actually communicates essentially to the breast that they need antibodies to whatever they're dealing with. And it's absolutely incredible. It's essentially living, right? It's a living, breast milk is living liquid. I don't know what else to call
Wow.
it, but it changes depending on what baby needs, which is absolutely just remarkable. And that I'm not sure if I answered your question there, but
Yeah, no, you did, and it's even different in the evenings versus in the
yeah.
mornings, and so anyone who's kind of pumping and freezing their milk needs to be conscious of, is this morning milk? Is this evening milk? Like, that kind of stuff.
Yeah, all
It's
of
so
the
fascinating.
the chrono situation, the words escaping me with milk. It changes at night. So at night it's going to have more melatonin in it, more tryptophan, more things to help baby sleep. And then it changes in the morning to essentially help baby wake up. So I don't like moms who are pumping to go crazy over it, because I think that especially if you have a tendency to be a little bit more on the anxious side, you can go really nuts with like labeling milk and like trying to make sure you're matching the right time. So, don't go crazy. But if you do have the bandwidth, it can be really, really great to give that PM milk in the evening, and morning milk in the morning. Yeah, it's so fascinating.
Mhm. And I did hear someone talk about how it turns back into colostrum around 2 years. Have you come across anything about that?
No, it doesn't necessarily change back into colostrum. It stays pretty much mature milk. I mean, it always is going to have what baby needs. So if it needs more kind of immune factors, that stuff, it will do that.
Mm,
But yeah, it still absolutely provides benefit to our toddlers. I will hear people say things like, oh, it's just for comfort at that age. And no, they're still getting something out of it. Even if the majority of their calories are from food, they're still getting all of these wonderful immunoglobulins and other incredible things in the breast
mhm,
milk.
mhm. Yeah, there's a lot of benefit too, just like when you talk about that bandwidth of like mom and parents, like when you have a sick baby or toddler, it is such a great tool. Like, you can literally just do like a 24-hour breast milk cure. Like,
Yep.
baby doesn't get anything else, or toddler doesn't get anything else except for breast milk, and like magic, they're better
Yeah,
the next day.
it's
It's
absolutely
incredible.
amazing.
And you don't
Yeah.
have to do any research. You don't have to Google. You don't have to head to the doctor unless you feel like it's necessary. You can just do this in your house, and the wisdom of your body provides everything that
Yeah.
your child needs. It's excuse me. It's for the tired, sleep deprived
Yeah.
parents. It's such a great tool if you can make it happen. If you're on that breastfeeding journey and you want to continue that, it's
Yeah.
yeah, it's so great for eye infections as
Oh my gosh.
well.
Yes. Yes.
Yeah, yeah, anything that
Even
comes
for
up
your own eye
randomly.
infection, if you get pink eye, it's
Exactly. Yeah. I know I was reading in some like traditional textbook, or
yeah.
actually it was my it wasn't even that, it was my grandmother, and we were talking about eye infections, and she's like, "Oh, we would just find someone who's breastfeeding in the village, and we would ask for like a little bit, and that would be
Yeah.
the cure, right?" So
Amazing.
it's pretty incredible, I think.
Yeah.
Um, and uh, and yeah, and obviously it's free and it's accessible and all of these things. So
Yeah.
it is so ideal. I did want to ask something that I've recently come across. My daughter, who's 5,
Mhm.
and I breastfed on demand throughout the night, and obviously less so after 1 year.
Mhm.
But she has quite a bit of cavities, and then they asked about breastfeeding, and I was like, yes, I breastfed, and they were like, oh, it's probably like quote unquote milk mouth, and no, no. Okay, let's talk about
Hearing
this.
you so much.
Oh,
You
really? Okay,
rage building, Cindy the rage.
let's talk about that rage.
That is such outdated information. And I get so frustrated because for some reason dentists seem to hang on to this. Like it's gotta
Mm,
be the breast milk, right? But
mm,
there's actually cavity busting microbes in breast milk. So it's way more
mm,
related to genetics, to the oral microbiome that ends up developing than it is to actual breast milk. So I think the kind of the difficulty comes into play in that when babies are fed anything other than breast milk in bottles, and they may fall asleep with it, and it sits in the mouth, then you can for sure develop cavities and develop issues from that. But breast milk is not going to do that. And I'm blanking on the microbe. It's some staph, like staph mutans or something like that. I don't remember. Somebody's probably yelling at me right now because they know what it is. But it's actually protective against cavities. So you can go back to that dentist and say, no, absolutely not. It was not the breast milk for
okay,
sure.
so we can blame genetics or
Yeah,
something else instead. Yeah.
yeah,
Okay. Okay, that's good
absolutely.
to know. I
Absolutely.
was like to the dentist, like I thought it was good for you, you know.
Yeah.
Um, but yeah, lots of factors to consider with that.
Yeah,
Um,
exactly.
yeah, and I did want to ask another thing, like how long is normal? I know there's always variation, like based on the individual, but what's an average length of time to be lactating after you stop your breastfeeding journey?
Yeah, it really, really depends. There are some women that, a couple years down the line can still express breast milk, and that's a normal thing. So it's not abnormal to be leaking milk or being able to express milk is really what I see more commonly a year or so later. There's really no normal there.
Okay. Okay, that's good to know. I was curious because I know some people it's like 1 week, they're dried up,
Yeah.
and
Yeah.
personally I'm still able to express breast milk, and
Yep.
it's been like maybe 8 months.
Yeah.
Yeah. Yeah. So I'm like, okay, this is interesting. Excuse me. Um, so since we touched upon sleep a little bit, so you want to so you're considered a holistic sleep coach.
Hmm.
And I know with sleep, there's, different camps, people who are really into sleep training. And then there's responsive parenting.
Hmm.
Um, and yeah, so what is considered biologically normal sleep support?
Yeah.
There's all
So
these different terms.
yes. So it is sleep support that looks at what is normal, that focuses on improving sleep by looking at what is normal for baby's sleep. There's so much focus on, well, babies should be able to sleep through the night. They should be able to put themselves back to sleep. They should be able to self-soothe. And none of that, with what we know from current neuroscience research, from looking at biologically what infants do, none of that is really does that happen normally. Yes, there may be some unicorn babies that can sleep through the night at 4 months or 6 months, but the majority can't. The majority of 6 to 12-month-olds wake 1 to 3 times a night, and they need our support getting back to sleep. That is a completely normal thing. So holistic sleep support, or sleep support that looks at biologically normal sleep, looks at things that influence sleep outside of like letting your baby cry, or putting them down drowsy but awake. So more things like manipulating timing of sleep to really make sure that melatonin is released appropriately, doing things like looking at the environment of the sleep space to making sure that there's no light that is could be interrupting melatonin production, or that could be disturbing baby in some way, making sure that naps are appropriately spaced, so sleep pressure has enough time to build up. So it's really looking at these biological factors that drive sleep, like sleep pressure, like our circadian rhythm, and working to maximize those so baby can get as much sleep as they can, and it's still a very biologically normal way.
Okay, I see. So it's like just doing our best to work with the natural rhythms of the baby. And I'm sure, like we talked about bandwidth, like what is the bandwidth of the parents to do all of these things? And I think depending on, how the birth process goes, how like mental health of the mom or parents, it might be more, excuse me, ideal to move a little bit more towards sleep training at that point when you're just kind of like at your wit's end. But these are things that I think are very, like common sense, and would just like support that process, whatever direction you choose to go into. But what about when baby is used to sleeping on the breast and mom is trying to get away because she doesn't need to nap anymore when baby's napping, or she wants to have a little time to herself, and that pull.
Yeah. I mean, it's totally valid, right? To want to make those changes. Yeah. And when I have moms that want to do that, my advice is always that we move as slow as possible, always paying attention to how the baby responds, because some babies, if we want them to nap independently, some babies do really well with that. And you put them down and they, put them down asleep and they stay asleep, and they don't necessarily need anything beyond that. Whereas other babies need that process to go a little bit more slowly, and need to do something like habit stacking, for example, where you layer on those sleep cues in order to make a much bigger change. So it's absolutely possible to still be incredibly responsive to baby's needs and make these changes that mom is maybe eager to make, as long as we're going slowly.
Okay. So a slow and steady process.
Exactly.
Okay.
Yeah.
That makes sense. And is it possible that baby is using mom as a soother?
Well, yeah. I mean, babies breastfeed for all sorts of reasons, right?
Okay. Like not actually eating.
Really,
yeah.
It's the other way around, right? So really, pacifier or soothers take the place of the breast, not using it. Yeah. I mean, I think it's important to remember that babies breastfeed for all sorts of reasons, right? They don't just breastfeed for nutrition. They breastfeed for comfort. They breastfeed for to help them fall asleep. Like there are like that sucking motion does help baby fall asleep. It increases the production of cholecystokinin, which helps us sleep. And they do it for comfort. And honestly, you know, I'm still breastfeeding my toddler, and I feel like it's such a superpower because he gets hurt and I can breastfeed and I can get him, you know, back up and running around in seconds. And it just, you know, for me at this stage of life I'm in, it makes life a lot easier to be able to nurse and to provide him comfort in that way.
Yeah, it is a superpower.
Mm-hmm.
Yeah,
It
I
is.
agree.
It is. Mm-hmm.
For pain relief, if they have to undergo any kind of uncomfortable procedures or anything, like
Oh,
it's
yes,
just, I
absolutely.
had a friend who traveled with her 8-month-old. And so for that discomfort of the plane taking off and
Yes.
landing, she was like, it was magic, you know, like we
Yeah.
didn't have to deal with any of the crying and the pains and all of that.
Yeah.
So it comes in
Absolutely.
handy for more
It
reasons
does.
than one,
It does.
for sure.
Exactly.
Yeah, yeah,
Exactly. And it's just
yeah.
to clarify, not to go back to the cavity discussion, but it's strep mutans. I think I misspoke, but strep mutans
Okay,
is in breast
okay.
milk and acts as an antimicrobial.
Okay, okay, makes sense. So I did want to clear that up just because it
Yeah.
really did confuse me because
Yeah.
from what I understand, it would only promote. But
Exactly.
either way, we have to fix some cavities. So
Oh,
that's what it is.
that's
It is what it
that's
is.
a
Yeah.
journey for sure.
Yeah, yeah. So Kate, before we head off, is there anything that you're kind of like, I just wish every, you know, new mom knew this, or someone who's about to enter motherhood, you know, that transition into motherhood makes
Yeah.
lessons, because you're so much about mothering the mother, and I think it's, you know, how our culture should shift our view of, you know, new moms and really support them. Yeah, is there anything that you're like, I just wish that every new mom knew this before?
Yeah. I really wish moms understood the importance of getting support for themselves and how important that is. I know that with my first, and I see this played out over and over and over again, that we fall right into that mother martyr. It's so easy for us to do, to put ourselves on the back burner, to put all of the focus on baby, to essentially sacrifice our health and wellness for years because we're focused on baby. And I just want moms to know that you deserve that support, right? You deserve to feel good as a mom, and your baby deserves it as well. They deserve to have a mom that is healthy, that is happy, that is getting her own needs met, because it truly, truly makes a difference. And the support is out there, and I don't want moms to have to suffer for years and years because they put themselves last in those early weeks, those early months.
Or early years, and how it can affect our wellness later on in our own lives, like as we enter perimenopause and menopause and all of
Yes.
those things.
Yep,
Yeah.
absolutely. Women that suffer from more postpartum depression are more likely to suffer from depression as they enter perimenopause and menopause. And so it really, how we experience postpartum really matters for, you know, for our health for the rest of our lives. It's not just this finite amount of time.
Mm,
It has a trickle down effect for sure.
yeah, yeah, absolutely. And going back to, like, you're the first person I've heard mention postpartum heart disease.
Mhm.
And so it shows that it's like all of our systems are involved and shifting and changing. Excuse me. And the more support that we can get when we need it most, which
Yeah,
really I feel it is the postpartum period.
yeah,
The better we are, the better off our babies are, the better off our families, our communities, and into the future with our health and wellness as we go through the different stages of life. So it's it's worth it. It's not just worth it. It's like a non-negotiable.
right, right.
Yeah,
Yeah,
absolutely.
absolutely.
Yeah.
Absolutely.
So, Kate, you might have heard me talk about this profound imprint, like when a new life is entering this reality, um, we're imprinted with something. And I do feel like it stays in our cellular memory, and it's not permanent. If something, you know, is unexpected, and whatever the events that take place, they take place, and it's can be out of our control. And we can do things to repair that. Dr. Sarah Buckley um, says, lots and lots of skin to skin can repair those hormonal gaps that take place when things like that happen. But ideally, we're imprinting love and safety and trust onto this new life. And those are all signatures of oxytocin, which is, the big birth hormone, the cuddle hormone, the love hormone. And if that can stay in the cellular memory of this new life, of the next generation, if enough women are supported, then I do feel like you can have this massive ripple effect and shift the trajectory of the world as we see these events take place. So I see it as like, it's a microcosm. Like every transition into motherhood is this microcosm of the world at large. And so I would love, like, my mission is just to support that in happening. And for the listeners, if you were to imprint something onto them, so it is a lot of new parents, new moms, people preparing for birth in their whole fertility journey from preconception to postpartum, and also the people who are excited to birth something beautiful into this world, a creative endeavor, a business that they feel will impact the world positively. What would you like to imprint onto the ears of the listeners?
Oh my goodness, that's so beautiful. Just love, so much love. I have such a strong belief that moms can change the world. And this is when it starts. And that was so gorgeous. I'm gonna cry. My goodness.
It's big, right? Well, especially for us, because we're like so into this. Yeah, 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 yeah.
Yeah.
I know. Love, it always comes down to that. Like, no matter what the answers are from the guests that I interview, it always comes back to this, like, love and support and community and, like, all of these things, like, we can't really buy,
Right.
but that we can cultivate. And yeah, it starts with, for me, I feel like it starts with, like, the birth process, and
Yeah.
we're birthing something beautiful. So thank you so much, Kate. Thank you for taking the time. I feel
Thank you.
very blessed to be in community with you. I feel very honored for you to take the time and to just share all of your wisdom, because you have so much. You're a naturopath, you're a lactation consultant, you're a holistic sleep coach, you're a mother, you went to a new country and you're building your life there. So thank you so much for imparting your wisdom. And yeah, we will definitely reach out again, and me and you will stay connected. And anything else you want to share, we'll just set up another episode.
Well, thank you so much for having me. This was such a treat to get to have this conversation.
I feel the same way.